Hi, my name is Jamie Marcus, and I am 65 years old. I live in Delray Beach, Florida, with my husband of a little over 23 years. And we have two wonderful boy-girl twins. We moved to Florida 8 years ago. We were living in New York, and prior to that, I am a Jersey girl from New Jersey. I was having some breast pain. Although I usually flew up to New York every March for my annual, I decided to stay local and go to Lynn Cancer Institute and have it done 2 months earlier. At that point, I was informed that the area that I had my pain in was completely clear. There was nothing wrong there, but that I had potentially something in my other breast. And they saw the tumor and I had a biopsy right there and then.
So Jamie has been my patient since her diagnosis, and she presented with some minor symptoms in her breast, pursued her appropriate mammogram. She was up to date with her screening. So her final diagnosis was a stage 1 breast cancer. So stage 1 means small cancer, negative nodes, which puts her in a very good prognostic categories.
And then I met with one of the breast specialists at Lynn. First thing I said when I walked in there was, am I going to die? I mean, I was new to this. You know, you hear cancer and that's where your head goes, unfortunately. She said, I promise you, you will be going to their graduations and dancing at their weddings. Really made me feel so calm and so wonderful. And so I felt much, much better. And then when I met with my surgeon, I felt remarkably better. He was really like being in the hands of God to me. He was amazing.
And she subsequently pursued with Dr. Coletta at Brooke Regional Hospital a lumpectomy and sentinel lymph nodes. So they removed the cancer, just the small bit around the cancer, and then sampled nodes under her arm, which is the standard approach in many patients for small breast cancer.
I was diagnosed in January. I had surgery 2 weeks later, and then I think it was 4 weeks later, I started radiation.
Okay, so she's done her surgery. Radiation was part of her management because she did a lumpectomy. And then the final part of her management was to consider hormone, what's called adjuvant or preventive treatment. In the case of a patient who's diagnosed with stage 1 breast cancer by early detection by mammography, their prognosis is excellent. So by the time her biopsy was done, her surgery was done, she was considered cancer-free.
It's only been 9 weeks since all this started. And my family, I got here.
Breast cancer has made me more humble and more of a giving human. I think I've become kinder. You could hear I'm getting emotional. I just feel that, you know, life is so to be lived. And even with a diagnosis that may at some point bring you to a lot of treatment and a longer journey than I had, it doesn't mean that you won't be well at the end.